Nathalee Kong, Chair of the Revere Board of Health. Tonight's meeting is an opportunity for residents to directly ask questions to Mayor Arrigo and to Dr. Kong about the state of COVID-19 in our city and the city's overall health status as the pandemic enters its 5th month. You may post your questions on the Facebook page. Some of you have already submitted questions through email. Unfortunately, that function is not working at the moment, so if you have questions, please utilize the Facebook process. We'll start tonight's discussion with remarks from Mayor Brian M. Arrigo. Mayor Arrigo.
Thank you, Bob. Good evening, everyone, and thank you all for tuning in to our what is our 6th virtual town hall on the City of Revere's response to COVID-19. It's been about a month since we've last joined you. It seems like it's been a lot longer than that, but it has been since we've had the pleasure of having Dr. Kong on with us. And what we wanted to do was make sure that we're continuing to provide a venue for residents to ask any questions, give us any feedback. And we thought it would be important, especially tonight, given that Phase 3 in the Commonwealth of Massachusetts did start yesterday in terms of reopening. And we are also seeing across the country some of the other states, especially down south and out west, who are being overwhelmed by the virus. Our team continues to work incredibly hard on behalf of the residents of the city and the business owners in our city. We've been focused on making sure that we're supporting a safe and responsible reopening strategy, and making sure that we're providing resources to the individuals and the families who have been most severely impacted by this pandemic. We've also reopened City Hall officially. It's open to the public now, and we do have a lot of health and safety protocol and procedures in place. And so that's why I still encourage everyone to continue to do as much as you can of your city business online or by phone. Nearly all of our city services are available either online or by calling 311. And in the event that you do have to come to City Hall, we have additional protocols in place for your safety and for the safety of the employees in City Hall. With the Commonwealth's Phase 3 reopening, a number of additional establishments have been allowed to open. This includes gyms and fitness centers, indoor recreational and athletic facilities, movie theaters, and outdoor performance venues. And so our team has continued to work closely with impacted business owners to answer any questions and make sure that we're providing the support as best we can. And I know Dr. Kong will speak a little bit on this, but the importance, I cannot stress enough, the importance of remaining vigilant through Phase 3, and how I know we're going to hear from Dr. Kong about how she's advising her own patients in their decision-making about certain activities. So as our economy reopens, we're starting to see, I think all of you are feeling the economic impacts here in the city. And so in response to that, the city did announce 2 very big initiatives that I'd like to talk about. One is around workforce development. We've hit a really high number of unemployment. We're at 25%, and that was reported on pretty widely. And what we've done, knowing that we were going to be hit with an economic crisis on the heels of the pandemic that we've faced, we've set aside $1.5 million of federal money, state money, city money to help Revere residents get back to work, really focus on growth industries that are here in the city, and take advantage of some of the new opportunities that are available, especially with a company like Amazon, who is reopening and or opening later this month and is ramping up their hiring program. in the days and weeks to come. We've also set aside $1 million in federal funding to assist Revere residents and families who are fearing eviction and homelessness once the state's eviction moratorium expires. That program has already received 300 applicants from residents. We just launched that last week, and the fact that 300 residents have already reached out in applying for that funding really does show the devastating impact that the virus has had on the economic outlook of our residents. Before I wrap up my portion of tonight, I do want to take the opportunity to talk a little bit about some of the things that the city's doing around the fact and the addressing of racial inequities that exist not only here in the city but all throughout the country. A little while ago, together with Dr. Kong, we declared racism a public health crisis here in the city of Revere, and that was really to not only bring attention to the fact that this is something that we have to work on with make a priority, but we also are able to pave the way for additional funding that will allow us to really address social determinants of health and racial equity. And this includes efforts to provide more behavioral health support for our residents. This is around efforts for greater housing stability and, at the end of the day, economic mobility. We know, and I know, that there is a lot of work to be done for us as a community and for us going forward. And that work has to be done with more urgency. And that is exactly what we are doing. And one thing that COVID-19 has really highlighted is the disproportionate impacts that we've had in terms of health and well-being of our residents, and especially in communities of color. And of course, the continued violence and systemic racism that's perpetuated against our Black and Brown residents here in our city. We won't be able to achieve meaningful change by ourselves. And I want to thank all of the residents who and the members of our community and the organizations that have stepped up and have continued to advocate for the rights of all of our residents. I want to make clear that I will continue to work to fulfill my promise, which has been to use my position, the mayor of the city, to make sure that the city of Revere is doing the same. I'll end by saying that I want to thank all of you for the sacrifices that you made to get us to the place that we're at right now in the city of Revere, where our numbers have dramatically decreased. But I also want to make sure and ask you to continue to do your part. I know it hasn't been easy. It's been very difficult. We've been through all of the changes, all the regulations that have had to take place, and all the things that we've had to do. But we have to continue to be vigilant and smart about limiting our exposure to each other, making sure that we're practicing social distancing, and of course, continuing to wear a mask. And that's especially important if we want to continue to move in the right direction. We've made great progress, and we want to continue that. And I think seeing what's happening in other communities, other states, and all across the country really has been eye-opening for a lot of people. So I want to just show my appreciation for all the great work that you've all done in listening to the guidance and the expertise from people like Dr. Kong. With that, I will turn it over to Dr. Kong, and I want to thank her again for all the work that she's put in during this pandemic, and truly, I think there are so many heroes that have come out of this pandemic, but we are incredibly lucky to have Dr. Kong as the chair of our Board of Health, and somebody who cares so much about the well-being and the health of our residents, and to have the expertise that we have as a city to rely on, it is incredibly important and has really saved lives at the end of the day. So with that, I'll turn it over to Dr. Kong, and again, thank you for all you've done for our residents here in the city of Revere.
Thanks a lot, Mr. Mayor. As always, it's a pleasure for me to be here. It's become abundantly clear to me as I'm seeing more and more patients in Revere in a virtual capacity, which is the safest way to do visits right now. But it's become abundantly clear to me that my patients are watching, so it's been really fun to talk with them about it. I'm thinking of one patient in particular I saw earlier this week. I told him I'd give him a shout out, so I'm not going to use his name, but hello there, hope you're watching. This community, I love this community, and it's definitely been challenging, but it's also been very rewarding to be in this position to help make sure that the residents of Revere stay as safe as we possibly can, keep them during what's been a really tragic and difficult time for the whole world. With that being said, Ruben, if you can put up my slides, thank you. I wanted to start off by going over kind of where we are as a Commonwealth. This is a really confusing slide, but I think the most important thing to look at are the percentages on the right-hand side. Every step of the way, Governor Baker, Mayor Arrigo, and the rest of our emergency response team, we have been reopening the state and our city using data. We've been using data regarding how many positive cases we have, how many patients are hospitalized or intubated with COVID-19 in our hospitals, what is the capacity like in our hospitals, and that has allowed us to really guide our decisions. And I think that's really where all of our success has been. Look, the percent change since April 15th, when we really started looking deeply into this data, we have had a 94% reduction in the positive coronavirus tests in the city. In the state. We're definitely seeing the same trends in our own city. Our average, number of new patient cases is in the single digits now, and that's thanks to every who put on a mask, who washed their hands, who stayed home, and who remained vigilant even when it was really tough to do so. So that has definitely helped to stem the spread. We stemmed the spread, we were able to keep enough hospital beds open so that we can take care of the patients who really needed to be hospitalized, who had coronavirus, who may have had pre-existing conditions. So since April 15th, we saw a 95% reduction in hospital surge capacity. We saw an 89% reduction in the average amount of deaths from coronavirus, which is amazing. Everyone in the city definitely helped to save a life of their neighbor, their family, their friends by doing the right thing. And then the last thing is the number of COVID patients hospitalized, 83% reduction since April. So our numbers are still looking good, but unfortunately the fight is not over. We are still seeing statewide, the average is a couple hundred positive cases a day. And again, in Revere, average is about somewhere in the single digits for probably like 5 cases per day. So we're still seeing positive cases. It's still out there, but all the different measures we've implemented and all the different measures you guys are listening to is causing a vast reduction in the amount of cases. Next slide, please, Ruben. So this is the Revere data. You can see way at the bottom over there, 7-1, that's the beginning of July, and our numbers continue to stay down. I think what's going to happen is as we continue to reopen and as we continue to explore our new normal, we're going to have a baseline positive number of positive cases. And if we can keep that to where we're at now, we're doing a great job. We don't want to be back to where we were in April, back at the peak. We definitely don't want to see, tons of people dying unnecessarily and tons of people hospitalized unnecessarily. So keep on doing what you're doing. Again, remain vigilant. The fight is not over. Next slide, please. And then I think this is a very sobering demographic to really drive home the point that though we're seeing great numbers here in the city and the state, the fight is not over. The rest of the country is really seeing massive amounts of new cases. We were coming down towards the end of May and June. You can see the curves flattening a little bit, but since the summer really kicked off, we've seen a steep increase in the number of daily new cases to the point where we are eclipsing the number of new cases on average that happened back in the supposed peak between April and May. We're seeing, almost double those numbers on a daily basis in our country. So again, if you think, the coronavirus is over and it's past us, just take a look at this graph and, that'll definitely tell you otherwise. Next slide, please. This is another sobering demographic. There's a lot of information here, but this is the one thing I want you guys to capture is that these are all the states that are seeing an increased number of cases. Massachusetts is not on this. Our case numbers are stable. We're the same, we're flat. But this is like a quarter of our country. This is a quarter of the United States where cases are going up. So, I know everyone's been sheltering in place for a long time, and it's the summertime, and this is when we travel. But when you do, please be careful. There is, it is an advisory in Massachusetts that if you are coming from a state that's outside of kind of the Northeast, it's advisable that you quarantine for 14 days upon returning to Massachusetts. And this is exactly why. So again, the fight is not over. We have to remain vigilant. Next slide, please. So having said that, I know I'm kind of saying one thing about, remaining vigilant, about the cases being, going up in some parts of the country. But then, it's hard to ignore the fact that we're now officially in phase 3 of the Massachusetts reopening plan. We're in part 1 of phase 3. More things are going to be open. Movie theaters are going to be open. Outdoor, music venues are going to be open. Lots more things are going to be open, in addition to all the things that have already opened, like restaurants. So it's and it is summertime, so I do understand people's need to kind of get out there and sort of try to live as normal of a life as possible. Some of my patients have been messaging me and asking me, do you think it's okay if my mom goes out to get her haircut, or do you think it's okay if I go out to do so and so, to do whatever, And there is no, one right answer for everyone. I think everyone is different. I think if you're older, and if you have pre-existing conditions, you really have to consider what it is you're going out to and doing. Again, we're all safer at home, so it's best to stay at home whenever possible. If you look at this this infographic that we've developed, you'll see the chance of transmission of coronavirus is virtually none if you're staying at home, right? So it is undeniable that we're all safer at home. But I recognize it's hard to do that. I'm realistic. Have I stayed at home every single day? No, I do go to work still, and I do go to the grocery store. So even I leave my home sometimes, and that's okay. But you have to just consider who you are, what your risk is for getting really bad outcomes of coronavirus, and then what is it that you're doing? Are you going to for a walk outside at a park? That's probably okay because you're in a well-ventilated area. You're outside. You can wear a mask. You absolutely should wear a mask. Maintain 6 feet distance between yourself and other folks. And then wash your hands frequently, 20 seconds with warm water. So as soon as you come home, definitely before you think of touching your nose, your mouth, or your eyes, definitely wash your hands as soon as you come back in from going anywhere outside. I think being outside, being in a park and walking is a low risk activity as long as you have a mask on, as long as everyone else around you is also continuing to do the right thing and wearing a mask. So you'll see one step above the virtually none is very low. And that's if both parties are wearing a mask and staying 6 feet apart. If you're going to be in a situation like a grocery store, that's going to be inside. Ventilation is not going to be as good, but not the end of the world. Hopefully you'll be able to socially distance between you and another shopper. Try to remain a cart apart is what I've seen in some grocery stores. And again, keep your mask on. You'll look up at the very top where the chance of coronavirus transmission is very high if you are not wearing a mask and if someone else is not wearing a mask either. So think about that when you are deciding if you can go out to certain places. I know a lot of our business owners are doing a fantastic job adhering to the mandatory safety standards. They're wearing masks. They're wearing gloves when applicable. A lot of outdoor dining venues are constantly disinfecting. A lot of places don't even hand out paper menus. They use kind of an online QR code so that you can just view everything from your phone. So everyone is doing a great job just using common sense, using science to really do their best to minimize transmission. And it shows with our numbers. But that doesn't mean, but even though our numbers are low, our numbers are not zero. All right. So it's not, I don't have an easy answer for every single person out there. What I would like you to consider are is this slide here, this infographic about the chance of transmission. And then on the left-hand side, just all the common sense things we've been telling you all to do. Limit your trips. You're safer at home. Wear a mask. 6 feet is the magic number. Wash your hands. Avoid crowds. Consider where you're going. Is it inside? Is it outside? Is it essential? Is it not essential? And consider who you are and what kind of medical, ailments you have. And also consider, can someone else do this for me? Do I really need to do this? And again, having said that, taking a walk out in the park, totally fine. Just wear a mask, maintain 6 feet distance. We all are definitely getting cooped up. So I don't want to, completely tell you like you have to stay at home. This is not a stay at home order or anything right now. But that's kind of the spiel I have for that. Something else I wanted to mention is that, we're in phase 3, things are reopening. I don't know if everyone recalls this, but when the phase reopening plan first came out, they had names. The first name, the phase 1 was just the start. The second phase was called the cautious phase. And the third phase is called the vigilant phase. And I think that's the perfect word to use. I know the mayor has been using it. I've been using it a lot tonight. And that's not an accident. I think that's the perfect word to use. We're starting to see some successes in what we're doing as a community and as a state. But that doesn't mean it's time to let our guard down. We must remain vigilant and recognize that it's not over. Again, those sobering demographics and infographics I showed you about the rest of the country, I really feel for the South and the West. Just understand that Texas, where it's particularly being hit hard, they opened the earliest. So we are a few weeks behind them in terms of how we're reopening. So we really need to be ultra vigilant, remain cautious, and continue doing the common sense things that you all have been doing to keep yourselves safe. And I think that's, you can cut the slides, Ruben. I think I'm all set with that. I think just the one extra plug I want to mention is that, one thing, and I'm not doing this out of bias or anything, but one thing is that, when we say you're safer at home, that means non-essential trips. Essential trips to the pharmacy, is fine. To your doctor's office is even more important. Again, I'm a PCP. I'm trying not to be biased about this, but truly, I've been trying to get my patients back into care, at least virtually, so no one has to leave their home because everyone is safer at home. But to try to reconnect with your primary care doctor and try to make sure your healthcare maintenance and all the other things that you're due for, your cancer screenings, whatnot, make sure that's still kind of on track. This is a marathon, not a sprint. It's been months since this pandemic started, and it's still going to be months until the vaccine comes out, I would say. So don't think this is just another few weeks or another month or so. Don't think, everything will be better in the fall. Whatever it is you've been putting off, try not to put it off any further regarding your health. All right. And that's all I got. Yeah. I guess we'll start the questions.
Okay. Thank you, Dr. Kong. We do have a number of questions, and believe it or not, questions that neither of you touched on during your opening remarks. This question has come up a little bit more in the past, but one question is, what process is in place for tracing and tracking COVID patients and the people that they come in contact with?
Yeah, so we've, since the beginning, we've had Carol Donovan, our public health nurse, alongside Adrian and the other school nurses. They've mobilized together and just became a dream team. And they've been doing all the contact tracing. We get all the information. Any resident of Revere who tests positive for coronavirus, whether it's the nasal swab or now the serologies, we know about it. We get the information, and Carol's team has mobilized since the very beginning to call patients. They have a number of questions that they need to ask them, and then which includes where they've been and who they've been in touch with, so that they can get in touch with close contacts. We are still recommending that folks who are a close contact of someone who has tested positive for coronavirus, we're still recommending that they too get tested. In addition to Carol's team, the Massachusetts Department of Public Health has employed the CTC, or the Contact Tracing Collaborative, which are folks that are also working alongside our nurses. They're just more boots on the ground. During the height of the pandemic, we were just getting tons and tons of cases a day. And it was so hard for these nurses who were working day in, day out, weekday, weekend. So we're very grateful to have some more backup, some more reinforcements. And the CTC is still in place, collecting the data, making the phone calls, and ensuring that folks are quarantining properly, ensuring that folks are getting supported while they're quarantining, and ensuring that any close contacts also get tested.
Yeah, and Bob, before we go to the next question, I do want to just commend Dr. Kong and our team from the emergency response team, and that includes Kim Hanton and Carol and Adrian, as mentioned, and all of our school nurses, because we were doing contact tracing before contract tracing was a term that was being used. I think at the time, and Dr. Khan, correct me if I'm wrong, but we were calling it acquaintances, and our team was actually using their own cell phones and their own phones to call people before this is a known kind of practice and a best practice for how to get in touch with folks. We were doing it from really the beginning. And, I think the Boston Globe recently reported on this, and the fact that we had been basically doing that. And that was, I think, in large part due to the fact that we had such a kind of well-rounded and knowledgeable team put in place at the very beginning, and with our emergency response team, and with folks again like Dr. Kong advising us and saying we need to know who these people have been in touch with, and we need to make sure that we're getting in touch with these individuals so that they can either quarantine or be able to be to make sure that they're not infecting more people. So I just a shout out to everyone that stepped up, and especially our school nurses. They all went way above and beyond. And I remember the Zoom call I was on with them months ago about the fact that they had been putting in so much work, and just showing my gratitude to them, but also hearing from them that there were some barriers to getting in touch with people, and how we could get around those, and what we needed to do. And that was all before contact tracing. The phrase was a thing that we were doing in the Commonwealth and really throughout the country. So just props to our team, and especially Dr. Kong for that work, for what they've done.
Yeah. And one more thing to add too is, the work is so important that they're doing. It's better to quarantine a few individuals who are positive than to issue another stay-at-home order, which essentially quarantines the whole city and state. It's always better to quarantine those high-risk folks than to have to blanket quarantine the rest of the Commonwealth or the rest of the cities. So it's so important. If you have been exposed, if you did test positive, you are going to get a phone call from the contact tracers or from our school nurses. So please pick up the call. So important. It'll help mitigate the spread tremendously.
Thank you, Dr. Kong. This question is addressed to Mayor Arrigo. Mayor, I've been in many places where customers are not wearing masks. What does the city do about this, and how can I report it?
Yeah, I would encourage anyone who sees anything that doesn't look safe to make sure that they're getting in touch with 311. And that would be the first stop, and we can make sure that we're directing that request to the appropriate enforcement folks. And this is something that we've asked, from the beginning. I've been asking residents if they see anything that doesn't look right, or that they feel like they're feeling unsafe, that they let us know. And I am confident that I have probably at least 52 of the 53,000 people in the city who are willing to be inspectors in some way, and eyes and ears for what's safe. So again, we want to hear from the residents. We want to make sure that, and we want them to know that we'll take action if there are any requests or logged complaints about certain either businesses or other places.
Thank you. Dr. Kong, this is an email inquiry, and I think this person suspects you have some inside information. Dr. Kong, what do you know about a vaccine? And a follow-up question, if not everyone gets a vaccine, will the virus continue to spread?
So unfortunately, I don't have any insider information on the vaccine. I wish I did. But it definitely is in development across the world, to be honest. And my bet is on, I'm a little bit of a pessimist, so take this with a grain of salt, but my bet is probably not till early 2021 is when we'll have it. And even when we do get it, it's going to take some time to vaccinate the whole population. In order to get herd immunity, you need to have something, I'm going to get this wrong, I know it, but something along the orders of like 70% of your population needs to be vaccinated, right? So you need to get a high number, and you don't just get 70% of the country vaccinated overnight. So it is going to take some time. It's going to take some time and effort to, ramp up vaccine clinics, to, obviously, produce the vaccine en masse. The other thing too is, it's not, I don't know what's going to happen in 2021, but I don't think, anyone can make vaccines mandatory. I don't know if the Supreme Court will like that. So not everyone will probably get it. I think that's the reality is we have free will, and not everyone, we're all adults, and not everyone can get will get the vaccine, though I hope most people will. The question remains is, will 70% of the population get it? And if not, then then it will continue to circulate. The good news is that it will continue to circulate to a point where, maybe everyone who doesn't get the vaccine will get the coronavirus, and at least they'll have antibodies for the short term. We're thinking maybe the antibodies last 3 months. The only thing we don't know is whether or not the antibodies that you produce after getting the virus will even protect you from the virus. So that's those are uncharted waters. I'm not 100% sure what we're going to do in that scenario. But it's just having the vaccine is the first step. The next is ensuring that we can vaccinate as many people who want it as possible. And then the next step after that is seeing, have we vaccinated to a high enough rate that herd immunity will take hold. And just to take a step back, what I mean by herd immunity is that if you have a group of 10 people, and if 7 of the 10 are vaccinated, you actually protect the other 3 as well, because there are just so few people that the virus can actually infect that it will just never make it to those 3. It kind of bounces around, right? And it just doesn't have enough opportunities to bounce around among enough people. So you protect it. You end up protecting those 3 folks who didn't get the vaccine. So that's kind of a very basic explanation of what herd immunity is. But that's what we're hoping for. That's what the goal is. It'll take a little bit of time. But who knows when the vaccine will come out? I wish I knew.
No inside.
Feel free to let me know.
There's no inside information there.
No, I wish.
Mayor Arrigo, these questions relate to the schools. One is with regard to high school graduation. I hear that high school graduation will take place this summer. Is this true? And how is that expected to be safe? And the follow-up question to that is, are schools expected to open on schedule?
Yep. So both of the answers to that question are really guided by state guidelines. And so in terms of graduation, yes, it is happening. It will be in August, and it will be limited. And we're, again, taking the necessary precautions to make sure that that seating is limited and the number of people are limited. That unfortunately for the graduates, that the or maybe fortunately, I don't know if they don't enjoy the long ceremony, this will be a much shorter ceremony this year, and there will be every measure taken to make sure that is safe. Second part around schools is a much more difficult question to answer, and one that the superintendent had just, if the asker or the person asking the question is a parent, we have of a student in the school district. We've actually sent out, or Dr. Kelly sent out an email just the other day asking individuals to sign up for their reopening committees in each school. And so I would encourage anyone who's interested in knowing more to maybe try to get involved in that reopening process. The other part is that the district is really hard at work planning for a bunch of different contingencies around how to reopen schools. And there's still some additional state guidance that has to come out around that. And there's additional financing that's coming around that. We just got, we were informed recently that there will be additional amount of money, of state money, available to our school district to help with reopening. And I expect that there may be more coming. And so as we find ways to be able to reopen in a safe way and find the money to be able to reopen safely, I expect we will be able to get back and have students back in school in the fall. But it's going to be really it's going to be difficult, and we're going to have to make sure that we're planning. And I have an extreme amount of confidence in Dr. Kelly. Just during this pandemic, she stepped up and has been a leader as a superintendent in the Commonwealth. We had a meals plan in place for our students and for families of the district before other districts were even thinking about how to provide food, lunches, and meals to their students. Dr. Kelly was already ready with a plan and had it in place virtually immediately upon the closure of school. So I know that reopening, I have the utmost confidence and respect for Dr. Kelly in her work to make sure that this goes smoothly. But so much of it is going to depend on state guidance that we get, and that will be forthcoming throughout the next days and weeks.
Thank you, Mr. Mayor. Redirect the medical aspects of COVID-19. This question for Dr. Kong. Dr. Kong, what do you think is the reason for a reduction in the fatality rate, even where cases are on the rise?
Yeah, so I think something to consider is what is the average age of the patients who are now getting infected? What we're seeing in the South and out West is that there is a growing number of younger folks who are getting infected with coronavirus, which is accounting for a large part of increased cases we're seeing. in the South and out West. Younger folks tend to recover from the coronavirus. Most younger folks who don't have any, comorbid medical conditions can actually end up safely recovering at home. Some of them may need to be hospitalized, but thankfully they are recovering. The other thing to note too is that, this isn't March or April. Thankfully, this is not new. So a lot of hospitals have shared information with each other. And there's a growing body of literature on how to best care for the coronavirus. So it's no longer let's just try everything and see what sticks approach anymore. Not that it was like that before. I don't want to disparage any of what my colleagues in the hospital have been doing. But now we have, best practices, so to speak. We know that proning works. We know that we need to ventilate in this manner. More information is coming out on what we should give patients up front instead of waiting a few days. The other great thing too is that compared to March and April, our tests are coming back faster. It's easier to get a test. We're getting we have a greater testing capacity now than we did back in February, March. We're still not testing enough, I don't think, but it is getting better slowly but surely. Our capacity is ramping up, and I think all those things taken together are contributing to the relatively lower reduction in the relatively lower rate of mortality we're seeing now compared to a couple months from now. The truth remains, though, that we're around 130,000 deaths in America, so not something that you can, bat an eyelash at. It's still a tremendous number. It's a tragic number. So even though people aren't dying at the same rate as before, we are still seeing some folks pass. So just again, vigilance is the key word this evening.
Thank you, Dr. Kong. This question, Mr. Mayor, is directed to you. Will outdoor dining continue as a regular activity at restaurants in Revere?
Yeah, that's a great question. That's one that I remember talking about in a prior virtual town hall. The fact that we have to think about some of our spaces, especially sidewalks and other public spaces, a little bit differently, and that is something that I would like to continue to see happen as we get feedback from the business owners and the restaurants that are doing that throughout the city. We want to try to even think about how we can make that a more permanent solution for different restaurants and different business owners. So I would love to continue to see that. In fact, I'd like to see it even more. I know some business owners have been hesitant and haven't been necessarily willing to take the chance of having outdoor seating. But in the places that it has happened, I think it's worked pretty well. And we have a great team that's been in place working with our businesses on the resource side, making sure that that businesses are receiving some type of technical assistance, but also unfortunately, from the enforcement side, and making sure that whatever they're doing is really safe for the residents and for their patrons. So the short answer to that question is yes, I would love to see more outdoor dining and continue to see it throughout our new normal.
Mr. Mayor, this addresses 2 points that you brought up during your opening. And maybe you can just reiterate those for the benefit of people who are interested. And that is, what help is there available through the city for businesses that need it? And then follow up to that is, how do I get connected with the city's unemployment assistance?
Yeah, those are two great questions and two great points. One is on the business side. We have been able to redirect a significant amount of federal funding to our businesses, and we've been able to put together a small business grant program. And to date, I believe that's delivered over $200,000 out in small grants, anywhere from $1,000, $1,500 up to $10,000 per business. And we ask people to please either call 311 or if you check the city's website, there is information about how to apply for that, and you can apply for it right online if you're a small business or if you know somebody who owns a small business in the city. That's on the small business side. Remind me of the other question, Bob. It was around
the other question had to do with getting connected to the unemployment assistance that's available in the city.
Yep. So in connection with the neighborhood developers, the city has put together a program called Connect, which literally connects residents with unemployment services and other resources that are available. And we've had that in place for a little while. That program has taken on a new life with COVID. And with the economic uncertainty that has followed the health crisis that we're in. So we do have the ability to connect people with unemployment resources and also with job training and other skill development. The other piece that I'll mention is most likely if somebody is facing unemployment or if they've lost their job, they may be worried about evictions. And one thing that I mentioned earlier is the fact that the city has set aside $1 million to help residents with rental assistance. So if you are unemployed, if you're worried about being evicted when the eviction moratorium, the statewide eviction moratorium does expire, we do have some assistance for you available, and again, you can apply for that online on the city's website. You can apply for that assistance, and we've to date already have had 300 applicants for that program, and we just launched it last week. So that tells me that there's a significant need out there, and we want to make sure that we're doing all that we can to rise up to the need of our residents.
Thank you. Once again, referring back to the issue of masks, what more can the city do to emphasize to people to wear masks? I saw over the 4th of July weekend large gatherings of people that were not wearing masks. Can there be more signs and billboards?
Yeah, we've had a pretty robust campaign around the wearing of masks and encouraging people to do that. And I take that feedback and we'll, I think we can think about how we can maybe double down on some of that communication work that we have done. We've had billboards. We've had the ability for digital billboards to have donated time to be able to promote the wearing of masks. And I try to make sure that I'm always wearing mine. And make sure that as lead by example and be able to kind of show that this isn't just these aren't just words that we're saying, these are actions that are being done by residents who do show some compassion and some ability to understand that this is really important. I guess I would take that that feedback and say that what we'll do is maybe think about how to be a little bit more clear and direct about the messaging around wearing a mask, and I know we've done a lot of work early on to encourage mask wearing. Maybe we have to remind folks again that needs to happen. Dr. Kong, do you have any thoughts or ideas about that?
So I was going to say that we did have our Mask Up May campaign, and I think this is definitely the right time as we're moving into yet another phase of reopening to revive that and to continue to take many different approaches to remind everyone to be vigilant. So whether or not it's just having a town hall to remind everyone, or whether or not it's having more signage out there to wear your masks, I think it's definitely important that we continue to see how we can send these messages from a variety of different angles. So I like that I'm glad to hear that feedback actually about not as many people as they should be wearing masks out over the 4th of July weekend. It's hot outside, so I know it's hard to wear a mask. So sometimes, if that's the case, if you get a mask that has more of an opening on the bottom, at least the air will kind of get funneled to the bottom. It won't go up into eyeglasses, and it'll feel like you'll have some more ventilation. So just some tips for folks who are struggling a bit with the weather. It's not fun. I have experienced it firsthand, and that's kind of how I get around it with one of my masks that is a little bit looser on the bottom. So just a pro tip out there for folks.
Good advice, Dr. Kong. This question comes from someone who is looking for advice and some help. Help for seniors who have stayed indoors since March. What programs may be available to them? And Dr. Kong, do you have any advice for seniors who are dealing with being shut in for such a long time?
Yeah, so it's hard. I speak to many, a lot of my patients are seniors who live in Revere, and I speak to them at least 1 or 2 a day about it. And I'm always encouraging to just take a walk outside. It is okay. I know it's really scary, but if you're just taking a walk around the block, put your mask on, stay 6 feet away from someone else. You see someone coming down the street, cross the street, or maybe they'll cross the street, It's not rude to do that. It's just safe to do that now. This is the new normal we're living in. So if you have been cooped up inside, if you've been afraid to go outside, but if you think you are suffering from it, mental health wise or otherwise, I know a lot of folks, have gained the quarantine 15. They haven't, been able to exercise. Gyms are closed. They've been a little bit more sedentary. Maybe their joint pain is coming back a little bit. I encourage you for the betterment of your sanity, your mental health, and also your physical health. Please try to go outside for some fresh air, walk around the block. Because we're so fortunate right now that the weather is, I guess it's a double-edged sword. The weather is great. Everyone wants to be outside. Everyone wants to be together. But on the other hand, the weather is great. We can walk outside before the winter hits. I think the coronavirus will still be with us this winter. And it's going to be such a shame when we can't walk outside as easily because the temperatures and the snow and what have you isn't going to really be conducive to that. So take advantage of what we have now to get some fresh air. Get some fresh air, get some sunlight, and just walk around, stretch out your legs. That is okay to do. Again, if you're outside, as I mentioned, if you're outside, you're in a well-ventilated area, you have your mask on, you stay 6 feet away. If that other person has a mask on, that is the next level up from staying at home. Your chance of transmission is really low. It's not as low as it could be. And you staying at home is going to be as low as it could be, but there are definitely some things you can do in terms of your mental health and physical health by just going out for a walk every now and then. So that's kind of what I've been encouraging all of my patients to do. In terms of what we've been offering, I know the Senior Center has had a lot of fantastic programming on your TV. I see Mayor Arrigo shaking his head. Mayor, you know more about this than I do, so I don't know if you want to chime in with some of the details about what Deb and team have been doing.
Yeah, and we've done everything from kind of check-ins, phone calls, and wellness checks to seniors to providing food if there's any food insecurity in the home, if there are seniors that need anything. We've been willing and been able to accommodate that. So I would encourage anyone who maybe any seniors, but if you know a senior who may be struggling or is looking for even something as small as a phone conversation and some companionship. We have a team in place to be able to make connections and help out with everything from something as small as a phone call to help around food or anything else that folks need help with. So and Deb has done an amazing job down at the Senior Center. She's done wellness checks. She's made herself available to go check in with seniors and do kind of social distanced visits with seniors, make sure that that they are getting in some interaction, some human contact, although not physical, but contact in terms of seeing and talking to somebody, another human being. So, which is so important, especially during this really difficult time. So, I would encourage any senior who's struggling with the difficult times that we're facing to reach out to my office or to 311 or to the senior center, and we do have an awful lot of programs and the ability to help out in whatever way that we can.
Okay, thank you, Mr. Mayor. We're coming up. We're at 5 minutes to 7. 7 o'clock was our scheduled cutoff point. So I'll turn it back over to Dr. Kong for any final comments and advice, and then she can hand it off to the mayor, and we'll call it a night.
Thank you, Bob. I think just the main things I want to stress in your remarks is what has been stressed all along. We're in phase 3. This is July. This virus has been with us for what seems like forever. So just continue to remain vigilant. We can't let our guard down. Our numbers are looking good, but we want them to stay that way. And they're only going to stay that way if we continue to be very purposeful about our actions, about what we do and how we spend our time, about wearing masks and washing hands and staying 6 feet away. It's a really unusual time in our lives right now. And I hope it doesn't last for too much longer. But we just have to sort of kind of lean in, like this is it for the rest of 2020. I think how it's going to be. So we've got let's just lean in and at least have fun with it. Buy a fun mask with a fun print, and take advantage of Zoom and Zoom happy hours, and take advantage of FaceTime. Try to reach out and just try to be kind to one another. Think of the folks who are working at the restaurants that are serving you, and think of how they're putting their lives on the line as well. To be there to get food, to get rent. To make rent for the end of the month and to get food on the table for their families. So just be kind to one another and continue to follow all the guidelines we've been putting forth all along. And I think as long as we continue to do that, I think we'll hopefully see the end. Thanks for having me as always. Mayor, on to you.
Thank you, Dr. Kong. And I just want to again thank everybody for tuning in. I know we'll probably be doing this again pretty soon. And again, I want to just thank everyone for the sacrifices that they've made, because if you look at what's happening all across the country, I know that some of the things that we were asking all of our residents to do were really difficult. But at the end of the day, they did save lives, and they prevented us from being in an even worse situation than what we faced. And so I just want to thank everybody for tuning in. Again, if they have any questions or concerns, please don't hesitate to reach out. We always have strived to make sure that our residents know that we're here to help them, and that everything that we do is to improve the quality of life and provide great service to the residents of the city. And that goes for the good times. It goes for the more difficult times and the more challenging times, like a pandemic. So again, I have to thank everyone who has worked from the city perspective, from the city side, everyone who has worked in response to this pandemic, and the incredible work that's been done. It really does make me proud to be the mayor of the city, and I thank all of you for tuning in.
Thank you, Mayor Arrigo. Thank you, Dr. Kong. That wraps up tonight's Facebook Live conversation about COVID-19. You will all be informed when it comes up again. But in the meantime, if you have questions or concerns, don't forget to contact Revere 311. They'll always be able to put you in touch with any departments or any individuals that can help address your problems. That wraps up tonight's discussion. Thank you very much, and good night, everyone.